And good morning, good afternoon, good evening, whenever you're receiving this information. My name is Rafael Vasquez Guzman. This is your show, Líderes del Futuro. And as we have been doing for almost a year and a half, maybe a little bit longer, we have Mr. Marcos Mejia, who works for the County of Sonoma. And on a weekly basis, he's been bringing information about COVID and what is happening with the vaccines and much, much more. And so thank you for taking the time once again and being here with us. And can you update us as to what's going on with, again, the vaccine and COVID in general?
Thank you, Rafael. Well, we continue with progress in the vaccination. As of today, 76.5% of the eligible population that is 5 and older is fully vaccinated. And to that, we need to add another 7.8% with people who has had at least one of the doses. And for the pediatric vaccine, there's enormous progress too. 18.4% of the kids between 5 and 11 have received their second dose, and another 15.8% has at least one of the doses. However, the cases continue to increase in Sonoma County, in Santa Rosa, and the entire county. So our daily case rates for every 100,000 is now 16.6. And our case rate for unvaccinated people is almost 52 for every 100,000, compared with 7.9 for every 100,000 for vaccinated residents. Our overall testing positivity is 3.1%, and our equity metric is 3.5%. As of today, we have 24 people in hospitals in Sonoma County, 5 of them in ICU beds. We added 2 more deaths during December because of COVID to total 418 along the pandemic. And this is in the context where both Delta and Omicron variants from the virus continue affecting our communities. As a whole, the country of the United States has recorded 819,000 COVID deaths. The US is now averaging 267,000 new infections per day. This is up to 126% in the last 2 weeks. So it's a dramatic increase in the rise of these cases. And we're averaging 1,200 daily deaths. So we're not in a good place, obviously. Here locally, Omicron has been reported in 14 cases, although we think that there is much more as we obtain more genotype and as we see the progression in the scale that this variant is affecting the country. The CDC has issued a recommendation to shorten the quarantine period for people that is not experiencing symptoms. On Monday, this Monday, the CDC shortened it by half the isolation period for people with these conditions. The isolation is, guidelines are saying that the clock starts the day you test positive. An infected person who go into isolation for 5 days instead of the previously recommended 5 days is the new norm. At the end of the 5 days, if you don't have any symptoms, you can return to normal activities, but must wear a mask everywhere, even at home or around others for at least 5 more days. If you still have symptoms after isolation for 5 days, stay at home until you feel better, and then start your 5 days your 5 days of wearing a mask at all times. The quarantine rules are for people who were in close contact with an infected person but not infected themselves. For quarantine, the clock starts the days someone is notified that have been exposed to the virus. Previously, the CDC said people who were not fully vaccinated and who came in close contact with an infected person should stay at home for at least 10 days. Now the agency is saying only people who got boosted can skip quarantine if they wear masks in all settings for at least 10 days. That's a change. Previously, people who were fully vaccinated with the CDC has defined it as having 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson could be exempt from quarantine, but now they're not, only people who got boosters. And talking about boosters, there have been 146,305 boosters applied here in the county, being the majority of them applied to people under 65, that's 84,000 boosters. And for people 65 and older, there have been applied more than 61,000 boosters. For this age group, 65 and older, almost 71% of their population is boosted now. However, we are seeing that vaccinated people, fully vaccinated people, and people with boosters, it's getting infected with Omicron as well. So we need to take precautions, maximize our mitigation measures that we know very well, which is wearing the mask, keeping your distance, avoiding crowds, not spending a long time around people that we don't know or we don't have a certainty about their status, because we can get exposed ourselves to infection. Although it's always important to emphasize that the vaccines continue to prove higher and higher that we are not exposed to severe disease, to hospitalization, or to death. Although infections, we may get infected. That's the truth. In all this context, the county is urging employers to require proof of booster to their employees. The county is, where I work, is revising the politics and talking with the union so we can implement this policy pretty soon. With us, probably in January, I will be sharing with you news about it. But for now, it's a recommendation that Dr. Sundari Mays, our health officer, is giving to employers to ask their employees for proof of having been vaccinated with a booster, or take 2 weekly tests for COVID in order to be at work and avoid the spread of Omicron. There have been several orders about this for different groups, requiring boosters for local school employees and personnel working in fire, in law enforcement, in emergency medical services, in pharmacies, in dental offices, and temporary disaster shelters in Sonoma County. This mandatory orders for these groups takes effect in February 1st, although public health highly recommends that employers cover their orders immediately and immediately begin testing unvaccinated and unboosted employees at least twice weekly, because of the numbers that we're having right now. The county mandate expanded a state public health order to require healthcare workers, adult care facilities, and caregivers, and correctional facilities and detention center healthcare staff to receive booster shots as well. Employers can require workers to be vaccinated, including having a booster. Additional employer resources are available from the California Department of Fair Employment and Housing. In addition, quarantine requirements are different for vaccinated and unvaccinated workers. Currently, unvaccinated employees must quarantine for at least 10 days if they come into close contact with someone who tested positive. Fully vaccinated workers, on the other hand, do not need to quarantine unless they have symptoms. And that concludes my report today.
Thank you for that information. And again, just reminding individuals, a lot of individuals are now having anxiety as a result of having, trouble for the holidays. They spend time in restaurants with people that they didn't know, gas stations, hotels, motels, whatever the situation is. And obviously they visited with other individuals. And, for sure, sometimes an individual may not be vaccinated. They go to this type of events and they choose not to tell anyone that they are not vaccinated and that maybe they were exposed to COVID. And for that reason, we are reminding the community of Sonoma County, the community rapid antigen testing is happening, right? So this is the COVID testing that is happening Sundays from 12 until 2 p.m. and Monday through Thursday from 4 p.m. to 6:30 p.m. And this is just walk in at 652 Petaluma Avenue in Sebastopol. This is an event that is being put together by the West County Health Centers and ISO Care Network. And so again, for individuals who may be wondering, maybe I have COVID and I don't know, I don't want to take it back to work. I don't want to get my family sick. I'm starting to feel some symptoms. I don't know if it is the flu, whatever the situation may be. Please keep in mind that they are testing Monday through Thursday from 4 to 6:30 p.m. and from on Sundays from noon until 2. And it is important, you can go to 652 Petaluma Avenue in Sebastopol, California. Now, one of the things that you mentioned in the Spanish version, Senor Mejia, is that people need to expect long lines because everybody's having some of this anxiety. It used to take maybe 20 minutes to do this. Now it's taking half hour, 45 minutes. So please plan to show up early. So if it starts at 4 p.m., by 3:30, you should be there. That way you're one of the first ones to go home. But also the other options, as you mentioned, is people can purchase their own. It is a little bit expensive. And if you have 5 and 10 people at home, it does get expensive. And that's why there are free testing sites like this one that I just mentioned. And then if you start developing symptoms of COVID and you have a primary care physician, please contact your primary care physician because they may be able to give you the test as part of your regular insurance. And so that is important for people to understand. One last time, I'll mention it. Monday through Thursday from 4 p.m. to 6:30 p.m. And then Sunday from noon until 2 at 652 Petaluma Avenue in Sebastopol. This is part of the West County Health Centers and ISO-Care Network. And with that, I want to thank you, Senor Mejia, for always taking the time being here with us. And I look forward to having you, when we are broadcasting live from the facilities at KBBF Bilingual Radio. I look forward to our next conversation next week, and I hope you have a wonderful end of the year.
Thank you very much, Rafael, and I wish you a happy new year and a very prosperous one and a very healthy year for everyone who listens to us.
Definitely.
Thank you very much.
Thank
I'll see you next Thursday.
Take care. Bye-bye.